Redefining diversity, competence, integrity, and work ethic through one location, one phone call. Introducing Signature Hill.
I want you to imagine all of those professionals with all those degrees. Many of them have never worked in a team in their life. And they're put on a stage in black tie and tuxedos. Who has a cello, who has a cornet, who has a tuba, who has a kettle drum. None of them have the same sheet music, and they start playing. There would be a lot of noise and a lot of disappointed people in that concert hall. Change the scenario. Add, after they practice, a conductor to walk in who they've agreed to respect. And the conductor raises his hands, and there is silence in the concert hall. And the conductor taps on the music stand, and they turn to a standard book of music. And the conductor starts them. The result is beautiful symphonic music. What makes us special is they've agreed to follow our direction and agreed to play off the same sheet music. And that's precisely what Signature Hill does. Signature Hill is the conductor for those wonderfully gifted musicians to the benefit of those people, customers who came to listen to us play. Hi, I'm attorney Angelo, and I'm here to talk to you about substance abuse, and I have a distinguished panel of guests with me who are part of our organization, and that is newsworthy in itself. We will get into the details later, but it's very important for you to understand that we bring an outpatient strategy to substance abuse, and we bring a diversified strategy. Those two things don't normally work well together. The old adage, 2 heads are better than 1, mathematically it should follow that 4 or 5 heads are better than 2. However, we have found that exponentially the complications increase to the point of breakdown unless that group is organized, unless that group is diversified and specialized. So the first message for you is that we are here in a diversified group, and to my left is Larry Forletta, a former DEA agent for the United States government, and now he works with us. Larry?
Thank you, Angelo. I'm the Director of Client Management Services working with Angelo at Signature Hill. And as he mentioned to you, I'm a retired law enforcement officer. I was with the Drug Enforcement Administration, DEA as it's called, for well over 20 years.
My next left is Charles Loreno, and he is our Director of Professional Providers, and he will tell you why he is here and what his experience is.
Thank you, Angelo. I've been in business for 32 years, developing business and administrative. I've been with Angelo since the beginning of our program, and I've been helping him with putting contracts and forms and language together that makes everything flow together well.
And he does a great job at that, and we're very fortunate to have him. To my extreme right is Dr. Robert Andolina. If you're from Butler County and listening or watching this media piece, you certainly are he's no stranger to you. He's very well known. We're very, very honored to have him as part of our group. He is a program specialist and the clinical director of all of what we're doing, and we'll get into those details in a little bit too. Robert?
Yes, my name is Dr. Andolina. I'm a clinical psychologist with over 30 years of professional experience in private practice as well as group, residential, and outpatient programs. I'm excited to be part of the program because of our emphasis on outpatient community-based work as opposed to residential inpatient treatment, which although needed is not needed as often as we would like to believe.
And basically that's who we are in the introduction phase of our program here, and who you are is important to us. You are probably a person who has a substance abuse issue or the loved one of a person who has a substance abuse issue. You may very well also be an authority person who finds a substance abuse person in front of you. You could be a criminal judge. You could be part of the parole board. You could be part of you could be a custody judge. You could be an employer with an employee problem. You could be a college dean with a person who has violated substance abuse rules in your campus, and we're going to explain to you why what we have to say is important in a minute. one of the common themes to our analysis to this problem is we have always, in the deepest recesses of our heart, us on this panel, you as the family member, or you as the decision maker or authority person, in the deepest recesses of our heart, we have always wondered, is this person a criminal? Is this person somebody who doesn't deserve a second chance? Or is this person a person who is sincere and wants basically to get a chance and deserve a chance? That's a pretty difficult question. It's become significantly easier, and we'll get into that detail later, but we now have breathtaking breakthroughs in pharmacology. I don't know if you know it, but there are drugs out there right now that a person can be administered on a daily basis with a pill or on a monthly basis with an injection, and he or she, medical things included, and all things being equal and qualifications aside, he or she would not be able to respond to the effects of the alcohol or the opiates upon taking that medication. Think about what that just says. What we're saying there is that it can be as easy as child's play in arriving at that fundamental question. If you have a person in front of you who has a substance abuse problem and they are urging you to believe them that they no longer want to be an addict or an alcoholic, dare them, if they're telling you the truth, dare them to take one pill a day or one injection per month and prove it. That's exciting for us in pharmacology. You know, alcoholism relates clear back to the Bible and Proverbs thousands of years ago. There are references to alcoholism. And it did not occur until the 1900s that there was any type of medicinal attempt to deal with that issue. As of 2006, we now have FDA-approved drugs. We're going to talk about that later in more detail, that a person can take to block the effects of alcohol and the opiates. And putting that team together has actually led me to discover this information from an addiction physician, Dr. Robert Woolhandler, who will be on our panel after our first break. Dr. Woolhandler and I worked constantly throughout the years, and we arrived at some very important observations. One of the first observations we made was that the most motivated person, that sincere person, was a person who was very likely to succeed and would be very responsive to treatment. So one of our first goals, and one of the goals of this panel, is to sort out, and we will sort out for you with objective evidence, who really wants to turn their back on alcoholism and substance abuse. Once we sort them out, we will get them committed to a team application. There are lots of people out there, more than you know, who do not belong in jail, who have health problems and not legal problems, who are not bad people, and our panel is here to tell you we have a way to sort them out and then get them started on the road to recovery and stay committed to that. I did not have probably the courage or the ability to do what my father did for our country in World War II, but I think this is a very important threat, and we're here to tell you that we're going to wage a real war on drugs, and we want you to join as a patient or a soldier, and we have good news for you. "75% of the people in jail in Pennsylvania, and it's probably true nationally, 75% of those people are in jail for drug-related offenses. 90% of the females incarcerated in Pennsylvania are there for substance abuse offenses. So if we could find a way to sort people out of that situation, not only does it save the taxpayers at least $50, $37 to $50 per day in what it costs to house a person, imagine the untold expenditures on the withholding that is never withheld to support our government from employment from people who are now in jail instead of being employed, not to mention foster children and the entire cascade of bad outcomes. Substance abuse is a habit. Habits are not easy to break. There's a leading jurist who's the current president of the National Drug Court Association from Eastern Pennsylvania that we quote many times in our literature, Judge Michael Barrace, who indicates that a person doesn't just wake up one morning and decide, today is the day I'm no longer going to be an addict. I'm going to break that difficult habit. We are not happy with the fact that there are mandatory minimums and the rigid standards and sentencing guidelines. But we'll leave that for the academics in a courtroom later. We recognize that there are people in jail who have health problems. They are motivated for success. Those people come to Larry through professionals organized by Charles and through the clinical program provided by Dr. Andolina. We sort them and then we put them on the way to a treatment program when they're most motivated. We actually take the legal problem and work the power of it against the health problem. And by doing that, we are working the health problem at the same time. So if you imagine two large pinchers, the legal problem coming at a victim and the health problem from their substance abuse, that's probably about as bad as it gets in your life, having a legal and a health problem at the same time. This panel of people here is about to show you how we take the power of both of those problems and turn the legal program into a friend and actually have a person be saved from a substance abuse when they're motivated most. Larry and I just worked in a case up in Beaver County in which we had a professional nurse, and Dr. Andolina worked with her and Charles with the professionals involved, in which that nurse is now home with her children and did not go to jail where the guidelines would have required her to go. She talks about that being the worst day of her life. By the way, it was a second birthday for her child. We have a video that relates to that if anybody wants to see it. The worst day of her life. The worst day of her life, she indicates on that video, became the best day of her life. Had she not dealt with that health problem, she would have most assuredly died early or gone to jail for a very long time. When she got arrested, she immediately went into a treatment program that was valid and real and included the blocker medications and the evaluation of people like Dr. Andolina. And today, that 2-year-old's mother is still home with that child. She has probation, and this state is not paying to incarcerate somebody who probably isn't a criminal. That's just one illustration, and we're going to go to the next area, which is assembling the team. The team we talked about here, sitting on our panel right now, is a team that once upon a time met with me over a cup of coffee, and one at a time we all began to believe in this. But we all know that the most gifted team in the world is not an effective team if it doesn't have a playbook. And we started with a program. Dr. Andolina is an expert at programs, and he helped us develop a 5-level program. Level 1 is sorting and commitment. Remember, we talked about sorting that person out. And Dr. Andolina knows full well that a person whose freedom is in jeopardy is probably more motivated than anybody. So we take the happenstance of that bad moment, like that nurse, and we turn it. And we turn it as the power and driving force to have somebody like Charles have professionals ready to treat this person, and have somebody like Larry ready to make sure that this person stays committed. Because we well know that sometimes people can sneak under the radar screen. We are a self-policing organization, and we have one of the best policemen to do that. In assembling a team, we also had to recognize and be cognizant of the fact that a person is a total person. He is a mental person. He is a physical person. He is a spiritual person. He is a person who needs multiple professions. So the multiple professions we put on board through the help of Dr. Andolina here, and through the administration of Charles Loreno, and through the self-policing program that Larry Forletta provides, has given us now a playbook. And we have a playbook, and we have a team, and we have an organization. And Charles sits on top of a registry of other professional providers, other professional rehabilitation centers who have agreed to follow that cookbook, who have agreed to cooperate individually in a team setting, and who have agreed to drive this patient to total abstinence so that this person could get high on life in the future instead of high on drugs. And we can save everyone a lot of time and effort, including a legal system that is staggering under the weight of drug prosecutions. We now have the makings of a complete recipe, and we have now our team in place, we have our professionals in place, and we have our cookbook in place. How does all of that work in an independent situation in which all of these professionals are independent and not under one roof? I have to thank my team members for that. And when we get to the next segment, we're going to talk to each one of them about how they play their role. We're back talking about substance abuse in our third and final segment. Joining us now is Dr. Robert Woolhandler, directly to my left. And Dr. Woolhandler has been a pioneer in the field of substance abuse. A lot of the things we discussed in the earlier 2 segments were findings that I made that were directly taught to me by this man. He is a wonderful family man, and he is a gifted professional, and he's well respected in this field. In fact, you're the director of drug and alcohol abuse in Fayette County, I believe, Doctor, right?
Yes, Angelo.
And how long have you held that position?
Approximately 14 years.
Okay. And prior to that, you've been in addiction medication for about 20 years?
Yes, I've been in the field of addiction medicine for approximately 20 years, and I specialize mostly in opiate dependence, and I work for 2 clinics. One, as you mentioned, Fayette County Drug and Alcohol in Uniontown, and I also work for SBHS in Connellsville. I also have a private practice in Pittsburgh where I see people for general medicine and addiction concerns.
When we talked about the breathtaking breakthroughs in these 2 drugs, it's in fact 2 drugs that you use. Obviously, a person may or may not qualify, but assuming a person qualifies, and we have seen the work we've done, most people coming to you have qualified. Assuming that they qualify, and that's a decision you will make, what 2 drugs do you administer and why?
Well, in addiction medicine today, we have 2 major breakthroughs. In opiate dependence, over the years, we've really not had a lot of good medications to help people. Today we have 2. One is Suboxone, which is a great medicine to help people detox medically.
And that would actually allow a person to wean down off of drugs without going into the pain of withdrawal, correct?
Yeah, it can take away. I tell people it will take away about 80% of the withdrawal. And any opiate dependent person who's gone through withdrawal, when you tell them that you can help them with 80% of that, they are much relieved. So,
and that goes back to the earlier thing I said when you were not with our program. Motivation is the key, and that certainly motivates them if they know they have a potential of painless detox.
Yes.
And then we administer the second medication, which is?
Vivitrol, which is an injectable form of naltrexone, and that effectively blocks the opiate receptors for 28 to 32 days with 1 shot.
So when we began this program, we talked extensively about knowing whether or not we're dealing with a person who's pulling our leg, quite frankly, or a person who really wants help. And I say now it can be as easy as child's play, truth or dare. If you're telling me the truth that you no longer want to be an addict, we dare you to take 1 pill per day or 1 injection per month and prove it, right?
Right, right. It's truth serum. It's actually compliance, too. If someone gets the shot of Vivitrol, we know that over that month they cannot use opiates. If they do not feel them in any way. And the big bonus is it also takes away their drug cravings. So we're able to go forward and initiate the treatment, the recovery treatment. Many people are drug craving, they relapse. If we can keep them stable off the opiates for a month, then the doctors that take care of them and teach them how to recover and not use drugs can do their job.
And in fact, we have now given them the power to just say no.
Yes.
It's one thing to just say no. It's another thing to be able to overcome that compelling withdrawal pain and those cravings that exist day in and day out afterward.
Right.
As I explained to our listeners in the early part of our show, not until the 2000s, although there are references clear to Proverbs in the Bible on alcoholism, not until the 2000s have we now have pharmacological intervention to create that power to say no.
Yes, absolutely.
And the other role that you play in our company is that you're a director of this division, meaning that you are willing to teach other pharmacists, other physicians, to do just what you do.
Yes.
And we, in fact, do lecture series like that. Now, doctor, we all know that a person sometimes, many times, does not have a substance abuse problem in a vacuum. And this would take us to the other member of our team, Dr. Robert Andolina. Dr. Robert Andolina is the director of our clinical division. And doctor, why is it important for you to be part of this? And why is it important for you to teach other professionals to do it the way we have determined works best most often?
Well, as you might guess, Angelo, substance abuse is a multifaceted problem. It's not a single entry, single exit. The idea is we've got a number of professionals together as a coordinated multidisciplinary treatment team working very closely to deal with all levels of the problem. So primarily it's very important for the medical piece to allow people to start to settle down and realize they're not going to go through the withdrawal process. However, a lot of the underlying problems, self-medication that people go through just to avoid problems, become tantamount to any kind of cure or recovery process. So our program, the way it's coordinated, allows each individual to communicate constantly what's the status of the person, what are the issues, are they compliant, are there any issues we need to address in our disciplines that might make our program more effective.
And what we're saying, Doctor, is it not, that Dr. Woolhandler's applications of treatment, it's important that you know when he applied treatment and what the next step is. So inherent in the process is the need to communicate as a team.
Exactly.
And of course,
exactly.
Dr. Woolhandler needs to know that you're picking up the back end, and he needs you to communicate, and we communicate more effectively because we have standardized documentation that you have helped develop on assessment and this interrelations. And part of those forms Dr. Woolhandler sends us after his application of treatment, and after he and the psychological division, the clinical division of compared notes, are exactly what the rules are for this person to get into, stay into, and successfully follow up with a long-term treatment plan. And of course that goes to Larry, and Larry, when you get those instructions to that patient, for example, this person may very well be assigned by Dr. Woolhandler to no longer have the relationships, environmentally or people-wise, that stimulated his drug dependency. So Larry now puts a GPS satellite bracelet on a person, and we can actually monitor from a satellite and exclude them from neighborhoods and people that they otherwise would be in contact with, which would otherwise encourage them to repeat, correct?
That's right.
And so whatever the plan is that Dr. Woolhandler has created is communicated to Dr. Andolina, who adds to that plan, sends it to the team members, and you're the enforcer, if lack of better terms.
Yes, sir. That's it.
Okay, and that's why this team concept is so important for you to understand, that this team was hand-chosen for the competencies they deliver, which will allow a patient full benefits. It will allow me, on behalf of a criminal defendant, on behalf of a custody client, on behalf of a person who's about to lose their college scholarship because they're going to be expelled from college, a person who's about to lose their professional attorney or doctor license, a person who's about ready to lose their CDL driver's license, a person who is about ready to lose their significant other. It allows me to get a plan from Dr. Woolhandler after proper assessment from Dr. Andolina and a complete report from Larry Forletta to show people that we now have a long-term plan. And Larry, in addition to enforcement, you also validate, right?
Yes.
Could you explain to us what the validation process is very quickly?
The validation process basically is to compile all the reports that the physicians have compiled together, and then subsequently we sign off on it as approval. And the team signs off on it as approved, and then subsequently it's sent to you. You oversee it, and if it's in the judicial system, then we bring it to the attention of the judges.
We call that evidence-based success. You know, it's nothing worse than going through life with a scarlet A on your back. And these gentlemen can tell you, one of the most frustrating things with treatment is when you finally find a person who is responsive to treatment, who has changed their life, and no one believes them. Our goal through Larry is to not only self-police, to take the workload off of an already overworked adult probation office, but our goal is to have evidence-based scientific data. We have alcohol monitoring bracelets that can be put on a person to demonstrate that they haven't had a drink for a week. Our message now shifts to who you are. You are either a judicial system that needs relief. You are an attorney who would like to work in this program. You are a provider of, as an addiction physician, a counselor, a case manager, or a professional director, or you may even be a clinical operation somewhere else in a rehabilitation facility. This team is ready to take you as a customer. This team is ready to take you as a professional associate. This team is ready to add our plan and our tools to supplement your treatment strategies. And together, we will do what none of us can do alone. We will take on America's biggest problem. We will take on the drug problem in this town, in this country, and we are going to now be able to deliver a knockout punch on the war on drugs.